Wrinkles and graying hair. We always consider these the inevitable effects of getting older. But as we age, we realize that our looks aren't the only part of us affected. We start to feel older too and become more prone to injuries. When Chef Pat Day suffered a devastating back injury on the job, even the simplest task became nearly impossible.
My mom had to help me put my pajamas on, and she had to help me to get up out of bed and go into the bathroom, and just the things that you think were normal for every day, I had to get help. And my wardrobe was made up of sweatsuits and everything that was spongy, because I couldn't put on any clothes or anything that would fit. And I could only wear flip-flops because I couldn't tie my shoes up. I couldn't put socks on.
Like many people who suffer with pain, Pat was told surgery was her only option.
I had 3 opinions, and they were all surgery. Not that the doctors weren't bad or anything, but that's what the options that they had that offered me was just surgery to correct the problem. Had I had the surgery, it wouldn't have worked because it wasn't what was wrong with me.
When she had all but lost hope, Pat heard about a treatment called prolotherapy, one of several regenerative injection techniques. Prolotherapy is an effective, minimally invasive treatment for many types of musculoskeletal pain resulting from repetitive activities, chronic sprains, excessive lifting, whiplash, trauma, or fall injuries. It will improve pain secondary to arthritic conditions.
Prolotherapy targets soft tissues. There is very little that we have available today to address the pain originating from soft tissue structures such as ligaments or tendons. And a prolotherapy is an emerging technology or an emerging modality of treatment, if you wish, to address pain originating from soft tissue structures.
Prolotherapy repairs damaged tendons and ligaments that cause chronic joint pain. When non-invasive treatments like physical therapy are unsuccessful, prolotherapy helps the body heal itself. By administering a series of injections directly into the affected ligament or tendon, blood supply to the tissue is increased and the tissue is repaired.
More people haven't heard of prolotherapy for the simple reason as there's nothing patentable about prolotherapy. If the solution that's injected, and there are many, many different solutions you can use in prolotherapy, if that was something that a pharmaceutical company could patent and charge large amounts of money for, everyone in this country would know about it.
After several months of prolotherapy treatments, Pat is back on her feet, back to work, and back enjoying life.
It gave me the ability to have my life back. I can't speak for anybody else except for myself. It gave me the ability to be a productive worker, to go back to work. And I believe that if it weren't for that, I wouldn't be able to have my life back, be able to do what I love to do and enjoy my life. And if it weren't for that, I would still be in pain, and I probably would be an invalid now.
Prolotherapy is going to have a large role in keeping our aging population active, because a lot of times what causes injuries as we get older are our ligaments and tendons fail us. They fail just like you can see our skin begins to age and you can see it's weaker than it was when we were 20. Well, our ligaments and tendons are doing the same thing. Our bones are doing the same thing. Most of the time your body wants to heal itself. We're just telling it where to heal itself, re-triggering the body to heal itself at the site of injury, which is real important because obviously it's maintaining our active lifestyle that's going to keep us young. So that's the goal of prolotherapy.
Dr. Joseph Valdez has helped thousands of patients overcome chronic joint pain and reclaim their active, healthy lifestyles. Through the minimally invasive treatment prolotherapy, Dr. Valdez offers a permanent solution without surgery. Dr. Valdez performs this outpatient procedure in his conveniently located Pasadena office.
My personal philosophy of treating pain is obviously you've got to make the correct diagnosis. There's many causes for pain. The real pain that exists can be amplified by a person's anxiety. They become depressed with chronic pain, making it then more complicated. After you've had pain for a while, other joints and structures become involved, So the philosophy is make the correct diagnosis and then apply the appropriate treatment.
Dr. Valdez evaluates each patient and develops a customized treatment plan. Through a series of injections directly into the affected joints, damaged connective tissues are repaired.
Well, the success rate for prolotherapy is going to vary depending on the age of the person, the extent of injury, how long it took to come in. I mean, obviously someone that's 85 is not going to heal as well as someone that's 25. Someone who has a minor injury that occurred last week is much easier to resolve than a major injury that happened a couple years ago. So the success rate will vary, but my experience is over 50% of all these soft tissue injuries will resolve.
Whether their pain is caused by an accident, a strain, or the result of aging, Dr. Valdez's patients say their results are remarkable.
I fell down a flight of stairs is what triggered my back trouble, and it progressed ever since. Every year it got worse, and it got to the point where I couldn't hardly go to work and stuff like that. This has been the best treatment by far that I've had in 10 years of treatments that has really helped me. I've been to spinal surgeons, I've been to pain management, I've been to chiropractic, and it's worked for me after 7 days of treatment, and it's getting better and better and better. Every treatment is getting better and stronger. I feel stronger, I feel more mobile, and I just, all around, I'm able to feel confident about picking something up off the ground. It's working that well for me.
My head hurt, it would start the back of my neck, go all the way to the side, and then my whole head would hurt. And my eyes, I'd had a hard time seeing. I was just terrible headaches. Dr. Valdez would give me an injection in the back of my head, and I'd go home, and then in a few minutes it was fine. And gradually, I can't remember how many I got once a week till eventually I quit having those terrible headaches. I come to see Dr. Valdez if I get out in the yard and say I work all day in the yard or in the garden, or if I do a lot of heavy lifting. My head won't hurt all over, but it'll hurt the back of my neck. And I'll come in and he'll give me an injection, away I go again. I thank Dr. Valdez every day. I don't have those terrible headaches anymore.
The thing that I want to tell Dr. Valdez is that he changed my life. He gave me my life back. He gave me my life back so that I can live it. And I really am very grateful. I will be forever grateful for that. Not only did he give me a second chance to live my life, but it gave me a second chance to really enjoy my life.
If you live with chronic joint pain, Dr. Valdez may be able to help. Don't suffer another day in pain. Make an appointment today. For more information, visit our website, valdezmd.com.